So I've been in clinical practice for about 20 years, and I've got a couple of areas that I specialize in. The first one being metabolic syndrome, which is what I did most of my graduate and research work on, in designing protocols and supplemental interventions for the reversal of total metabolic syndrome. And we ran various clinical trials and case series trials on it and had remarkable success with that. So that kind of became a stakeholder in our practice. Also working obviously with type 2 diabetes, that's so interrelated with metabolic syndrome, is another area that we kind of work with. And then sports, sports performance enhancement, where we take athletes, look at the genetic composition, we do some functional testing with them, and then designing intervention protocols and supplemental regimens for them to achieve optimal performance. I think any form of GI testing, but specifically GI map testing, is very helpful in looking at various levels of a person's health. And that's very important in the athletic medium because we need to understand the state of their immunity, because they are highly immunosuppressed, and we do find a lot of imbalances there. When we look at currently all the pesticides and herbicides that we have in our food supply, it's really helpful to look at any form of the specifics in GI map testing, because we can determine the levels of pathogenic versus commensal species and how that's affecting neurological behavior, and also attention deficit issues, which is the areas that we also work with in clinical practice with children. For instance, when you're working with the autistic spectrum children and you're looking at any form of stool analysis in the form of GI map, you might find overgrowth with Clostridium species, and you might find low levels of bifidobacteria and lactobacilli species. And I personally feel that there's a very strong correlation between that and some of the herbicides and pesticides that are used in the world, because they are actually of such a nature that they actually do destroy some of the commensal species. So it's really helpful to look at that stuff and to look at the level of that imbalance when we're working with attention deficit or autistic spectrum children. Glyphosate's interesting. It's been abused in the world for many, many years. I believe it's pretty radically used in the country of Australia now since 2006. The problem with glyphosate is that it is a chemical or a organophosphate that is water soluble, so it tends to go everywhere. It's also a chelating agent, so it pulls metals out of just about everything. So it pulls all the minerals that people need for their health out of the food supply, so people are finding less and less minerals in their food supply. Metabolic syndrome has always been a very big interest for me, because I feel it is a condition that is completely reversible. And I've always wanted to prove that in clinical trials or peer-reviewed journals or research, and I found that if you integrate many dietary interventions, proper supplementation, and lifestyle changes, you can reverse metabolic syndrome in anybody from the age of 12 to 77. It's not a genetic thing, it's a lifestyle thing. And the supplementation that I would normally use would be berberine, some of the products that are available in Australia, and the ubiquinol product that you guys have here as well.